So, thank you so much for joining and giving me some time out of your day. And so, this is the Wellness Hub where I talk to people in the wellness space, medical, physical health, mental health, where I'm big on giving people agency over their health, knowledge, and I think it's really important.
Oh,
Yeah.
that is music to my ears, girl. Yeah, I think that people understanding what they have to do to lead a healthy life is what I have spent literally almost the last 50 years preaching. I feel like, I once had a boss when I worked in industry for about 10 years, and then I went back to and it was still a clinical position, but you were in working for a company in a clinical position,
Okay.
which always has a sale edge to it, because it was about diabetes technologies.
Oh,
And she said to me, we're not in the business of selling here. And she said it kind of aggressively.
right.
And I said to her, Barbara, we're all selling something. I sell diabetes management
Mhm.
so that people can live a long, healthy life for it.
Right.
I said, you sell nursing education. I said, it's just a difference of perspective.
Right. Yeah.
And I think that what you're trying to do, Marsha, is really give people more information
Yes.
so they can incorporate that in a way that allows them to live a better life.
Yeah.
Because if we're not healthy, we're not living our best life.
No. Yes. So, can you introduce yourself to the audience? Tell us who you
Oh,
are and
would
tell
you
it. Yeah.
like me to start there?
It's fine. No, no, no. It's fine. I love to jump right into it because when I'm in this space with you guys, it just feels so natural and I feel like I know you. It's just, I love it when people are like, oh man, yes, and I've seen it for my own wellness. And just being able to have agency and just being able to have people on my wellness team to help me live the best life possible. So I want you
I
to
get that.
introduce your fabulous self and beautiful self
Okay.
and
I am not sick, but I am constantly drippy nose, drippy eyes. According to the allergist, this comes as we get older. I'm like, great. Can we fix it?
my mom suffers the same
So
thing. My mom
I
suffers from this.
know it literally, that's what they say. That's the allergist response. This happens when you get over a certain, he goes, a certain age. I'm like, okay, yeah.
Oh, okay.
So, at any rate, I'm Donna Jornsay. I'm a nurse practitioner, and master's prepared, and um, a, a certified diabetes care and education specialist with a board certification in advanced diabetes management. So, my focus, even as a nurse practitioner, has always been more the education piece
Okay.
because diabetes is something that requires you do something to take care of it dozens of times a day. So, my giving someone a prescription,
Yeah.
they may think of that as, okay, that's once or twice a day. And I want them thinking much broader in terms
Mhm.
of you've got to make a lot of decisions
Right.
all day long about taking care of your diabetes. So the more they know, the better they can do that.
Yes. So how did you get into this field? How did you navigate into this space? And yeah.
Well, I went to nursing school with the idea of um, getting a quick nursing degree so I could put myself through medical school. Okay. My parents didn't have two nickels to rub together, and I knew that I was paying for school, however that went.
Ah,
So I was like, okay, quick 2 year nursing degree. I'll get out. I can work one shift a week and make enough money to be able to put myself through medical school. And then a year after I graduated nursing school, with an associate degree, mind you, not even a bachelor's, an associate degree, I was approached um, by the university, which was Upstate Medical Center in Syracuse. They were starting a new nurse practitioner program, and I had been at the head of my nursing class. And so they were coming to me saying, we think basically you would be a great guinea pig. So we would like you to come on board with this um, new nurse practitioner program. It was a year-long program, and they were off, and the place I was working, which was the hospital for the university,
Okay.
was offering me a year, pay my salary for the year while I went to school. Now, this is 1975,
Okay.
50 years ago, literally. So sure, you know. So I became a pediatric nurse practitioner before I ever had a bachelor's degree. Now, nurse practitioners today have to get a doctorate,
Right.
but so then I went on and got a bachelor's and then a master's. And I started off in pediatrics, and I was running a program in the Bronx that was designed for kids with serious chronic illness. And we went out to their home. We had a driver and a big black bag, and we went out and we did, transfusions in the home. We went out and saw kids in school. You know, we did some incredibly innovative stuff
Right.
that now you have to come into a center and be there for 6 hours. And we were doing it in the burnout South Bronx in a 5-floor walk up with 4 little kids running around while you're doing this to their big brother or sister. I
Right.
mean, it was honestly like from another world.
Right.
And I had a patient that really got me fully into diabetes. I got called by the intensive care unit at this hospital, which was Jacobi Hospital, part of Albert Einstein Medical Center.
Right.
And the nurses in the ICU said, we have an 11-year-old who was just diagnosed with type 1 diabetes. And she's been here for 3 days. The first day she was in a coma, but she is not speaking. She will not say a word. So we want you to come up and talk to her, not as someone to get enrolled in your program necessarily, but as someone living with diabetes, because I was diagnosed with type 1 at 17.
Okay.
So I come up, and this young girl's name is Teresa, and she's in the bed, and the bed is all the way up. It hasn't been lowered because she's not gotten out of bed, and she hasn't said a single word to the nurses in the 2 days she's been awake. I say, hi, Teresa, I'm Donna, and the nurses asked me to come up and talk to you because they're worried about you because you're not talking to them. And they're concerned with what's going on in your head. And she what isn't making eye contact. And I say to her, do you know anybody else that has diabetes? Who's that? She shakes her head. Who's that? My grandma. I'm like, okay, I just got 2 words out of her. This is
Right.
great.
Right.
And I say to her, well, I want to tell you something. I have diabetes too. The kid jumps down out of the bed and pulls up the legs of my pants that I'm wearing and pokes my leg. Those are your legs? Yes. How did you find what happened to grandma? And she says, as the story unravels, she says to me, When grandma came home without her legs, I asked mommy what happened to her, and she said grandma has diabetes. So the girl was literally laying in the bed, waiting for the surgeons to come to amputate her legs. So I'm going to get teary eyed even telling this story because I remember and I thought to myself, I've got to do full time diabetes,
Right.
like just showing up. And then she said to me, and you're pretty and you don't wear glasses because all of her associations with diabetes were amputations, going blind. And at that point in time, there were a lot of commercials about that. There was actually a public safety announcement where the screen on your TV went black and it flashed blindness, amputation, heart attack. What do these have in common? Diabetes. And that was the commercial.
Oh man.
So, if you're a kid and you've seen this and you've experienced it personally by your grandmother now in a wheelchair because she no longer has legs, um, that's pretty dramatic.
Right.
Needless to say, Teresa became my patient until she was 25. When I said to her, "You really have to go to an adult doctor now, Teresa." I get, and she was very dear to me, very dear. Um, but that's what got me into doing full-time diabetes stuff. And I say to people, when I was a kid, I worked with kids. And then when I got to childbearing age, I ran diabetes and pregnancy programs. And then when I got older to this age, I started working with the old farts who get admitted to the hospital with, you know, and I became an inpatient diabetes educator, nurse practitioner. So it's kind of like my patients have aged along with
Right.
me.
Wow. So Donna, it sounds what you've done, like Teresa, like you're a patient of, like you said, childbearing, older patients.
All that. Yeah.
Yeah, but you've seen the lifespan. You've seen,
Oh, I have seen the entire lifespan.
yeah.
My youngest patient with diabetes was 4 weeks old, literally 4 weeks old. There's something called neonatal diabetes.
Oh,
And I had a guy in my last job who was 93 who was diagnosed with type 1 diabetes. And he said to me, "Isn't that what they used to call childhood diabetes? Juvenile diabetes?" I said, "It is." And he goes, "Okay, I'm glad some part of my body still thinks it's a kid." I was like, "You have got a great attitude."
wow. Wow.
So you're right, the entire age span. And, and there's honestly nothing else and that like kind of goes that whole range
Right.
and requires as much work as managing diabetes does.
Okay.
I had a mentor at one point early in my career who had MS,
Oh,
and she was a nurse and developed MS and got into working full time with people with diabetes because at the time she said, "There's not a lot I can do about this MS. I do what the doctors tell me to
right.
do, but it's not like diabetes where I can teach people how they can get better at this so they
Right.
can live a healthier life."
Right.
She said, "Me knowing everything I know about MS
Yeah.
is not going to change the course of
Her.
my life expectancy with this."
Right.
And that was a number of years ago. We have a lot more options for MS now, like we have for everything else.
Right.
But 40 years ago,
It's
we
not.
didn't.
Yeah.
Yeah. And so she was saying to me at the time, I know you're reluctant to give up your work as a pediatric nurse practitioner, but I think you, and she was a very spiritual woman. She said, I think you got diabetes for a reason.
Mm. Yeah. And because you do the work, it's, from a spiritual standpoint, it's sometimes when we go through things or when there's something that we navigate, because me being a therapist, I started off with being a play therapist. And
Ah,
it's interesting when you said,
that, yeah,
hey, I had children, I've had, just your own progression. And it's interesting as I've healed my inner child, that part of me, because I really wanted to give a certain age group a voice. I wanted them to know that I heard them. And then once I worked through that,
that's beautiful.
yeah, because, at that
No,
time,
keep going.
yeah. And so at that time, after I worked through that, it was then where I'm at now is I want my moms and dads to be able to heal so they can heal and their kids don't have to go through so much. And so now it's more family. And so your expertise and your story is so powerful. And I know that you brought that in with every patient you worked with because I can feel it. And I'm not your patient,
I
right?
get it.
You know?
Yeah.
And I guess my question to you is when somebody first, and you can tell me when somebody first gets diagnosed with diabetes, just like the patient you talked about, how do you walk them through? What is that? I think because sometimes we hear about diabetes, right? Sometimes we have
Yeah.
clients who get diagnosed with it, and they'll say, hey, I'm taking this medication, and they're not as educated. And that is one of the reasons that I want people from different walks of life on this show, because you've been in places that I haven't been. I can't talk about a subject that I can read up on, but you've been
Right.
your feet have been on the ground and hey, what's coming out? What does that look like? And so how do you navigate if somebody gets a diagnosis of diabetes, what's that space, because what's that space that they're in, right? How do how can you walk somebody through that? Because if you got diagnosed at 17, so you have your own personal, and then you have professional,
Right.
and I think about that for people with kids. I think about then there's diabetes type 2, and just
Right.
things that,
And gestational
yeah,
diabetes, people get it when they're pregnant. So it really does
right,
span that. And you hit on something that is part of where you go with this,
right.
because what your needs are if you're a kid
Yes.
versus the parent of a child. I have two very good friends who had 4-year-olds
Oh,
who were diagnosed with diabetes. And a 4-year-old can't necessarily recognize all the symptoms.
right.
And if you think about the mother of the 4-week-old,
Yes.
her husband was doing a fellowship at Columbia. They were from the UK. She had no family in the US. Um, and the first hour and a half I spent with her was her crying, and no education went on, you know? So I mean, she was just devastated.
Right.
You know, how am I going to do this? And this baby, neonatal diabetes, is an unusual diagnosis. And when I first met this family, which was 25 years ago, I was already 25 years into a career doing this essentially, um, but had never seen a baby this young. And in that last 25 years, I've seen maybe 7 or 8 babies that young. So it has become more common. As and the parameters of this changed. When I was first diagnosed, they started me on an oral agent because the time when you were diagnosed with type 1 was age 7 to 10 or 11. I mean, it was like a very narrow window. And and I went in after a week on the oral agent, having lost an additional 20 pounds. And at the time I was 5'7" and weighed about 100 pounds soaking wet. So I'm now down to about 80 some pounds. My mother said, "You look like you had been in a concentration camp." I could count every rib. And I say to the endocrinologist, "I think I need insulin." And he says, "I've never had anybody ask for that before." And I was like, "Well, I don't have a death wish, so I think we better get with it, you know?" And then I never went back to that guy
Right.
because he actually told me, he said to me, "You'll never see your 50th birthday," because that was the experience
Uh,
56 years ago,
right.
is people died from complications if they were diagnosed young. And but so the first measure that you're taking, to get back to your original question, is you got to see how devastated they are.
Uh,
Because sometimes you can't move on to educating somebody
right.
until they know that they're being heard
Mm,
and supported,
right.
and you've developed some trust.
Right.
So that's kind of like step one.
Okay.
And I used to say, when I was working with kids and families who were impacted by this, I'd say in the first 10 minutes, I can tell the kid in the family that's going to do really well from the kid in the family that isn't. And I remember one mother whose 2-year-old son was diagnosed. And at the time, I had a 2-year-old,
Okay.
and I was having a very hard time because I thought, oh, these people are really in it, and I would always try to put myself in their shoes and imagine how I would feel in
Right.
that space. And her response was, okay, not her husband's response, her response. This was their only child. She said, okay, tell me what I need to do to allow him to live a totally normal, healthy life. And I said to her, it makes me teary eyed when I remember some of these people and what they went through. I said, you are going to do fine. She said, how can you say that? I said, because that's what you ask. The people whose kids are diagnosed, who are saying, but why?
Right.
Why did he get this? Why did she get this? Why? I don't understand. And they can't get past that, really struggle because they want an answer that nobody has to
Right.
give them. And when I say to them, I really wish I could tell you, you got this. I
Right.
had a kid one time who told me, working in chronic illness, a boy, 11, also, Sean, who said, I know the reason I got this kidney disease. And I said, Sean, why? He said, because I went out and was riding my bike in the rain. And I said, Sean, that doesn't give you kidney disease. And he said, no, Donna, it did, because I was bent over the handlebars and the rain was hitting my back where the kidneys are. And I said, I get what your thinking is, but I promise you, that's not why you got this. So you got to get people past the why,
Right.
because the why doesn't do you any good.
Right.
What difference does why make now?
Right.
I had
Yeah.
a father who once told me he had 3 kids. I was with him when the first was diagnosed.
Mhm.
I was with him when the second was diagnosed. And when the third, he had 2 sons, and then the youngest was a girl. And when his daughter was diagnosed, he said, this was on Long Island in a very affluent area. I make too much money to have 3 kids with diabetes. And I said, I hate to be the first person to tell you this, but diabetes doesn't know economics at all. What you should be happy about is you can afford to give her whatever it is she needs. I said, that is where your economics is going to help you.
Right.
But it doesn't keep you from having children who are diagnosed with
Right.
diabetes.
Yeah. Wow.
You
So
know,
it
so
it sounds like mindset, right? It's and I don't want to, but the
it
mom who said,
is
"Hey, what can I do to make sure my child lives the life, a
that
normal
I
life?"
want for him.
Yeah,
Yeah,
it sounds really like mindset. And I don't want to go to, I think anything that we may get diagnosed with, we can get into a space of being a victim, right? Because what did I do to get,
abs-
right?
absolutely. And I
Yeah,
think that's a very easy role for people to assume.
right. Yeah. And it sounds like it's like the mindset, getting them to be in a mindset of how can I, what can I do to move, to live life so this is not, it's not a crutch or it's not a burden. And it sounds like, so if they come to you, like the mom, right? Because now they're open. They're now open to hear things. They're now open because she must have, you held the space for her. For you said, for
Yeah,
the first,
I
you held the
did.
space for her.
An hour and a half of
Yeah.
her sobbing. She
Yes.
needed a mother. She needed her mom from the UK, and
Right.
her mom wasn't there, and I stepped in to
Yeah.
be that for an
Yeah.
hour and a half. Yeah,
And then even thinking about that mindset, we get diagnosed, there's a diagnosis, there's mindset. And then my question, because I'm big on how do you build your wellness team? How do you build your medical team? What does that look like, right? When you went to your doctor and was like, well, what about insulin? And then the doctor saying, hey, you're not going to live past, 50,
and
and you never went back. And I think
I
people
did
need
it.
to realize you have agency of where you need to go. If this person does not believe in what you need to do or what you want to do for your life, I don't know if you need to continue going to that provider.
Exactly right.
Yeah. Yeah.
Because that person isn't helping you achieve your
Exactly.
goals.
Yeah. Yeah.
And his mindset was so negative,
Right.
that it was like, no,
Right.
uh-uh,
Yeah.
no. You
Yeah.
know,
And I
I
think that,
honestly think, I'm sorry,
oh no,
go
no, go
ahead.
ahead. No, no, no.
I honestly think, though, in some ways, we've talked about kids, we've talked about little kids, bigger kids. I think for many people,
Hmm.
type 2 diabetes is harder.
Share.
And I'll tell you why. The day I was diagnosed, or a week later, in this case, I needed insulin. Today I'm getting insulin. The day I die, I'll be getting insulin. Because with type 1, my pancreas doesn't make any insulin at all. If I don't take insulin, within 24 hours, I am going to be dead.
Okay.
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 Type 2 diabetes, which frequently comes later in life,
Right.
although we're now seeing a tremendous number of kids getting it because of the obesity epidemic and, public schools discontinuing physical education, all of that, and the amount of screen time kids spend, all of that. But we're now seeing that more often. But if you're the typical person with type 2 and you're older and have led a more sedentary
Right.
lifestyle, which kind of goes with it, it's much harder because now not only am I talking to you about one changing that lifestyle, but type 2 diabetes is progressive. So on day one, you may be on an easy medication that is very inexpensive called metformin.
Right.
But by 2 or 3 years into it, unless you have seriously embraced the lifestyle stuff that I talk to people about, by a couple years in, you need a second oral medication or an injectable medication to help you achieve the weight loss that might make you less. And then by 10 years out, you are very likely to need insulin. So it is a constant change, and we humans do not
Oh,
like
no.
change.
The
We
older you
do
get.
not.
Yeah.
And the
Okay,
older you get, the harder that is to do. So I would go into when I'm working in an inpatient environment and
right.
someone's newly diagnosed, I go into that room and they go, "You have no idea how hard this is." And I would say to them, "Actually, I do. I've had diabetes since I was 17, but I think what I'm asking you to do now is harder." And then I would explain to them what I just said to you.
Okay, so take me through diabetes type 2 and just because I'm perfect, like I'm flabbergasted by that,
Okay.
right? And so to hear that, right? The medicine that they take on the first day compared to the medicine that they take 10 days, like 10 years, and for you to say it's
10 years out.
aggressive, I'm I don't, and I can be wrong. I don't think the urgency of I don't think the urgency of that is put out there.
Oh, it isn't. You're absolutely right.
Oh my
You're,
gosh.
yeah. It's a great disservice that is being done by your internist, your family
I-
doctor, who says when you're first diagnosed, who says something to you like, "Oh, just cut out the bread," and doesn't talk to people about the fact that unless you really do something about this, I'll give you a money back guarantee you're going to be on insulin 10 years from now.
So, oh my god. Okay. So,
I once had a woman who said to me, "I want to smack you right now,"
oh shit. Oh,
when
shit.
I told her that. And I said, "I get that."
Okay. So if somebody, okay, let's walk through this, right? So if somebody gets diagnosed the first day, what would be some changes or education, right? Because I really think that primary care, I do think they do a disservice because
They
I've
do.
had clients that have been diagnosed and, you know, it's like, hey, these things aren't happening. And so what would be, if we just think about the first year or the first couple weeks in that, what kind of education would they need? Because I really think it's also mindset. We don't like to change the older we get, right? And what would be a first education or some tips in the first year?
Okay. The first thing I talk to people with type 2 about, I say to them, I make my fingers like this. I say, insulin is a key, and its job is to open up the door to your cell so glucose gets out of your bloodstream and into your cell where you need it.
Okay.
Right now, you are still making some insulin, but not enough. That's why your blood sugar's high. So we're going to give you some medication that helps that. But there's something else that you can do that opens up, that makes that cell door disappear. And people go, "What do you mean?" If you exercise, literally opens up the door to our cells, but the cell only stays open for 72 hours and then it closes again. So if you get some kind of physical activity, and it doesn't have to be exercise per se,
Right.
it could be vacuuming your carpets, it could be weeding your garden, it could be mopping floors, it could be standing and ironing even. If you get some kind of physical activity for 30 minutes a day, the door to your cell is staying open, so now glucose can get right in, and you don't need that key to unlock it.
Donna,
Now, yes.
I'm gonna have to like interview more or come and sit with you and have coffee or something because I am mesmerized. Go ahead, continue.
So the what someone needs is 150 minutes of physical activity a week with no more than 2 days off in between days. So if I exercise on Monday and Wednesday and Friday, I can take Saturday and Sunday off as long as I'm back to it on Monday, by Monday, because that cell door only stays open for 72 hours.
Okay.
So you can't be a weekend warrior. You can't do all your exercise on Saturday and Sunday and think that your blood sugars throughout the week are going to stay
Right.
normal. They're not. But if you can get in 50 minutes of exercise 3 days a week or 30 minutes of exercise 5 days a week, then you're keeping those cell doors open so the glucose can get into the cell. That's normal metabolism. That's what we want.
Right.
Glucose going into our cells so we're being fed, we've got energy to run on, and our brain is powered by
Right.
that, all of that.
I've never heard it broken down that way, right? Like to the key open 72
Yeah.
hours.
So that really works. I'm going to give you an example. I met a guy in the intensive care unit at the medical center I was working at, retired cop, 50, 51 years old. Um, and he was diagnosed with type 2, came in with a rip roaring infection because we know if you have high blood sugars, your body can't fight off
Right.
infection as well. So he comes in with this rip roaring infection and he's in what we call ketoacidosis, which typically happens with people with type 1 diabetes at diagnosis. It's rarer with type 2. Um, and so we weren't really sure. This guy was probably 25 pounds overweight, but it wasn't like he was morbidly obese.
Right.
And I tell Bobby what I just told you. Okay. And he became my patient for like the next 5 years till I left Long Island and moved to California. That was a long commute for his visits. So, um, but he, and so I tell him that, and he says, "Are you serious?" I said, "Yeah." Now, when he was first diagnosed, we didn't know if it was type 1 or type 2
Okay.
because he came in very sick, this rip roaring infection. He's in ketoacidosis, where he needed an insulin drip, and he was seriously ill. And there's a measurement, a 3-month measurement of blood sugar that's called a hemoglobin A1C.
Right.
And is under normal is in the fives or
Right.
sixes. Once it gets to 6.5, you're diagnosed with diabetes.
Okay.
His was 15. So it was almost 3 times normal. And I said to him, "You have been feeling lousy for months." I said, "Let me guess, you're waking up to pee 3 or 4 times a night because you're hungry all the time. You're exhausted all the time." He said, "Have you been living in my closet?" Like I'm like, "No, I haven't been, but I know this." And I said, "You feel like you have a cashmere sweater on every tooth. Your mouth is fuzzy. You're constantly thirsty." He's going, "Yeah, yeah, yeah." So I said, "We don't know yet because the blood test that will determine is this type 1 or type 2 takes longer than you want to stay here in my hospital for us to get." I said, "So I'm going to call you when those results come in, but right now we have to send you home on 4 shots of insulin a day." And he's like, "Okay." So I teach him how to use the insulin. I give him a basic instruction in meal planning, the idea that you don't eat all carb and you
Right.
have some meat, some potato, and a lot of vegetable and salad.
Right.
I have these demonstration plates. I have little like placemats that show you what your plate should look like. We go through all of that. I tell him the exercise thing, teach him how to use insulin. He's discharged on 4 shots a day. He I call him a couple days later And I say to him, okay, the blood work came back. This is type 2. You're I'm going to call in a prescription for you for the main type 2 drug that we use,
Right.
but I need you to keep checking your blood sugar and I need you to stay on the 4 shots of insulin a day because it's going to take a couple weeks for this drug to have any impact. And I said, and I want you to call me every couple days and tell me how your blood sugars are doing. And he says, is it okay if I start that exercise thing? And I'm like, yeah. He goes, I have a gym membership. I never use it. I have a stationary bike in my house. He said, I hang my clothes on it. I said, yeah, you and everybody else. He said, okay, I'm going to the gym. Okay, great, Bobby. Go to the gym. So we touch base every couple days. I run a support group once a month that Bobby comes to. He's talking to other people. He says to them, has she told you that exercise thing? And they're all going, yeah, yeah, we've heard it. Well, he says, she is guilty of making me into a gym rat. And he said, so first he gets off the insulin before breakfast, then before lunch, then before dinner. So now he's on one oral med and one shot before he goes to bed. Then he gets off of the evening injection. And then he comes to the next support group and I said, you've lost weight. He said, yeah, 15 pounds already. Now, I always say this to the women who are my patients. Our bodies, women's bodies, are designed to nurse a baby through a famine.
Right.
Guys can lose 15 pounds in a month.
Right.
1, 2, 3, not the women.
Right.
So, I always, when he comes in and he's 15 pounds lighter, the women in my support group are ready to growl at him,
Right. Yeah.
And I go, hang on, ladies, we're designed a little differently.
Right.
So, to make a long story short, over the course of 3 months, he was off of even the oral medication, had lost 35 pounds, looked better. He said, I didn't look this good when I was wearing a New York City police officer
Right.
uniform. He said, my girlfriend loves you. And I said, oh, that's good to know.
Wow.
And I stayed in touch with him when I worked in California. Um, and he would send me pictures and he'd say, you are so right. If I don't go to the gym for 3 days, all my numbers are higher. And I'm like, yeah, you only got 72 hours
Wow.
so he is, and now he does training and he said, I am so buff, I have to get custom made shirts. I'm like,
Wow.
he's having a great time.
Okay.
And he and his girlfriend have gotten more physically active together. They joined a bowling league, they were taking dance lessons. So, but Bobby is unusual. Most
Okay.
people can't do that.
Okay. And so what would be one thing if even if somebody's in their journey of diabetes type 2, what would be one thing that you would give, or it could be a family member, people who have to navigate it personally, or they have a family member, what would be one thing you would leave with them that you would want to leave with them regarding diabetes?
That's a great question. Um, I would tell family members to not become the diabetes police,
Okay.
to not be looking what everything that your husband or wife is putting in their mouth or that really strains a relationship.
Okay.
Um, and I would tell the person living with diabetes, I've had a lot of offers from people, would you like to come home with me? And I go, no, I got to go home with my own diabetes. And then I say to them, you've got to own this.
Ah,
If you want to live a healthy life
Right.
because you've heard about diabetes complications. And none of us know what is in our future.
Yeah.
But what I can feel good about is I'm doing whatever I can to not have those complications become my future.
Right.
I'm asking you to join me in that.
Mm.
Like, but this is your journey and you got to do it. So that's kind of where I try to, and there'll be husbands like, well, you know what, you just tell her what I need to eat.
Right.
I'm like, no, she doesn't have diabetes. You have diabetes.
Okay.
You've got to make the decision what you're putting in your mouth.
Right.
You got to make the decision if you're going to the gym. It's not your wife's
Right.
responsibility,
Yes.
and she's sitting right there. Is she going to be a support to you? I certainly think she will, and I hope she will. And she's sitting there nodding her head, yes. Um, but it's not her job
Right.
to take care of you.
Right.
It's your job to take care of you. And, that kind of like enforcing for people that whatever struggle we have in life,
Mhm.
if we don't own it, it's only going to get bigger.
Yes. I appreciate Donna. I'm gonna have to interview again because I know that there's so much more there. Um, but yes, I
Well,
thank
it's been a pleasure, dear.
thank you, thank you.